Hey everyone, good day to all. Myself Dr. Ajay Moria. So we are done until slide 84 and we are going to continue now as from 85. Okay, so let's go for the PDF guys. Link in the description. Okay, so guys, please follow. Okay, so the next slide is from the 85th one. First one is the we are going to learn about the hernia important points. Okay, na? Hernia important points here. Um, okay, so guys, here first one, the first one, how they are going to ask the questions is that I think you guys know what is hernia. It is the protrusion of bowels into abdomen, into what? Into scrotum, okay, or in the inguinal canal. That's it now. See here, which is the they will ask the question as that what is the what is the most common hernia in in both male and female? What is the most common hernia in male? Indirect. What is the most common hernia in female? Indirect. Both are indirect only. This question is already asked in the inset exam. In inset exam. Simply, what is the most common hernia in female? Indirect. But most of them are marked as the femoral. Array. If they ask you guys what type of hernia is more common in female, okay na? What type of hernia is more 4 times more common in female than it is femoral, or else mark the answer as the indirect only. If they ask particularly, then you have to mark the femoral, or else you have to mark the indirect. Okay, most common type of hernia in female, indirect, but femoral hernia is 4 times more common in females. Okay, if they ask. Next one, guys, you have to remember here this how we are going to differentiate between the indirect and the direct hernia. Okay, so first of all, you have to know something here. Okay, these are the layers of the skin here. Okay, here first one is the skin, then is the superficial. What is the first? We are having the what fatty areas, campus fascia, outer layer, then the inner layer is the fascia. Next, we are going to have the this one external oblique muscle, internal oblique muscle, transverse abdominis muscle. Okay, here is the transverse fascia here. Okay, here. So this is the anterior part and this is the posterior part. Then now, see, um, see here, this is the superficial ring is defect in what where external oblique muscle. See here, this is the superficial. This is the superficial muscle. So this is superficial inguinal ring. It is formed by what? It is formed by external oblique muscle. Deep inguinal ring is formed by transverse fascia. So whenever there is a defect in the whenever there is a defect in the whenever whenever there is a defect in the external oblique muscle, obviously there is a defect in the where in the superficial inguinal ring. This is also like this one. Okay, this is how they're going to ask the questions. Okay, deep inguinal ring, transverse fascia, fascia transversalis, fascia transversalis. Okay, here superficial inguinal ring, external oblique muscle. Transverse abdominis and the internal oblique muscle both combine here. They forms a conjoint joint. And one more question here. So, which is the anterior part? The external oblique muscle plus the internal oblique muscle. This is posterior, and this is the roof of inferior wall. This is superior wall. Roof or superior. Okay, this is the roof or superior wall formed by IO means what? Internal oblique muscle plus the transverse abdominis, and the inferior or floor is formed by inguinal plus lacunar ligament. Okay, then this is how you have to remember. Next one. See, wait me. I will turn off my camera. Wait. Okay. So guys, here see, um, here guys, see how we are going to differentiate between the direct and indirect. Okay, it is by what is the landmark? Landmark is the what? This is the inferior epigastric artery. IEA, inferior epigastric artery. Okay, na? See here, this is the epigastric vessels. Okay, na? See here, see, we are having two types, indirect and direct. Indirect, see guys, indirect hernia. If it passes towards the deep inguinal region, if it was passes towards the, see here, indirect one, this is indirect one. If it is passes towards the lateral side of the, where lateral side of the epigastric vessel, inferior epigastric vessel. If it is passes to lateral side of this is the inferior epigastric vessel. Lateral side of the inferior is called as the indirect hernia. When it is passes towards the through the where through the Hazelback triangle, then it is called the direct hernia. Okay, the landmark is to differentiate between the direct and indirect is the inferior epigastric artery only. Okay, if it is lateral to that one, it is indirect. If the medial to that, it is the Hazelback triangle. Sometimes they are going to ask you which one is called as the lateral hernia. This is the indirect hernia. Okay, so how you have to remember. So guys, come to the NYHS classification, guys. Here is European classification. Sometimes they will just going to tell you about the hernia. That is the 3B. Okay, 3B. 3B means what, Amma? It is means both direct and indirect. They are going to read something as just as 3C. It means femoral. 3A means direct. 1 by 2 it means indirect. 4 means recurrent. This is how, just remember these words. If they're going to mention the, okay, this is the 3B hernia, it means direct and indirect that they're talking about. Okay. Surgery, guys, you remember here. Surgery here. Remember, guys, this one, guy. This one. Okay. Anterior tension free repair. See here. The studies are not important, not more important, but remember the here. What is the nerve injury during the surgery? In, see here, in open hernia repair, that is the which one? It includes leg stents, tension free mesh repair. Okay, this one repair. What is the most common nerve injury? It is the ilioinguinal. It is the ilioinguinal nerve. It is the ilioinguinal nerve injury. Okay, na? Guys, remember here. Okay. Next one is the laparoscopic hernia. While doing the laparoscopic hernia with the tape and a tap surgery, there is a what? There is a lateral cutaneous nerve of thigh is going to affected. Here they will give you there is a sensation, there is a tingling sensation called as meralgia prosthetica. This is a meralgia prosthetica. There is a history. This was the during appendectomy, injury to dash leads to inguinal hernia. It is the iliohypogastric nerve. It is the iliohypogastric nerve. Next one is the dash injury to this during mesh fixation dissection leads to death. It is the corona mortis or aberrant obturator artery, also called as crown of death vessel. Next one, for the congenital hernia, guys, you have to do the herniotomy after 3 years. After 3 years only, you have to do the herniotomy. Okay, na? So, and also, guys, please remember that one mesh repair. Okay, there's a mesh replacement, guys. See here, for the mesh, guys, please search in the Google for the mesh. Search in the Google. For the mesh, guys, we are going to use the polyprolene. Okay, prolene. It is the material made up of the prolene here. Polyprolene here. Okay, why you are going to insert this mesh repair mesh? Why you are going to insert this one? Because the What is hernia, guys? Hernia means what? Due to there is a weakness of the abdominal wall. Okay, so mostly is the posterior abdominal walls are going to weak. That's why you are going to insert there for the support. Okay, for the strengthening. This is how you are to. This is how they are going to ask the questions. Done. I already thought about this one. Okay. Next one, guys, STD. Sorry for this one because there is a copyright issue. That's why I just cover this one. Okay, now please try to read in our PDF, good PDF. So that's the STDs. We are having the two types: painful, painless, painful, painless. Painful, we are having the herpes and the chancroid. See here, chancroid. Chang cried, cried. See, Chang cried here. Cried, cry. See, H ducre, ducre, ducre means what? Do, see, do cray, do cry, cry, cry. Means it is a painful. Herpes vesicle, I think everyone knows it is painful. It is called the herpes 2. There is multiple vesicles here, polycyclic erythematous, and you have to do the watermark, acyclovir 800 milligrams 5 times per day. Okay, now this is the Chang smear. You have to differentiate between you will see the here Jane said you'll see the Jane said if it is the viral. Okay, Nama. Next one is the Chancroid C caused by Chancroid ducroid. It is caused by H ducre. It is a non-inducible. This is the non-inducible. It is hard, very hard, hard. There is dirty margins. That it is also called as it in the in the microscopy, you'll see the school of fish appearance. This is the school of fish appearance. Okay, treatment will the azithromycin. Next one is the painless. We are having the three things. What is this one? This is the syphilis, donovinuses, LGB. Syphilis is called by Triponema pallidum. This is having the durated. This is soft and we have the clean base. Dark film and in the dark field microscopy, guys, we'll see there is a corkscrew pattern. There is a corkscrew pattern like a bacteria. And also, guys, if they ask which is the best one, it is the VDR is the best one. Treatment with the benzathine penicillin. Okay, na? See here, see here, penicillin. See, syphilis, painless, syphilis, painless, penicillin. PPPPP. Then, na? Next one, donovinuses donovinuses say caused by what? Caused by Klebsiella granulomatosis. We have in the papules. This is the bleeds. That is the watermark. It's a bleeds easily. There is a beefy red. There is a beefy red ulcer. There is a beefy red ulcer, also called a granuloma inguinale. It is how it appears. It is the safety pin appearance. Safety pin appearance, overhanging margins, and this contains the pseudobubbles. Treatment is the azithromycin. Algevira lymphogranuloma. It is the caused by chlamydia trachomatis. There is having the inflamed nodes. There is a true bubbos here. This is the pseudobubos, but here is the true bubbos. True bubbos. Here, green blood sign. There elevated. How elevated? Oval single ulcer and the lymphatics blue ball sign. If you see this one, microscopy, you see the blue ball sign. We are having the two times L1, L2, L3 types, and this the site is the most site is the vulva is the most common site. Treatment with the doxycycline. Okay. Next one, here the see in the entire gynecology, guys, if you find this one, if they ask the question, the guys, about if they mention that there is, if they mention that there is a absent uterus, then you have to think about only these two scenes. Okay, only these two scenarios, that is Mullerian agencies and the complete androgen insensitivity syndrome. Okay, now syndrome. So guys, please see here. Please see here, guys. This is the case. This is the case. Suppose example, a boy. Suppose example, a child born. Suppose example, a child born. Okay, so guys, and the doctor told that, and the doctor told to the parents that, congratulations, you like, there a girl, a baby girl is born. Okay, the parents are very happy to that one, and they went. So after 12 to 13 years, during the menses time, during the menses time, the parents again bring to the child to the doctor, and they said that, doctor, my girl, baby girl is not having the menses. At while doing the karyotype, it comes to reveal that, oh my goodness, it's a baby boy. It's a baby boy. It's very shocking because, guys, there is a undescended testis. There is a undescended testis. That's why, there is a undescended testis. That's why it leads to what? It seems to be, it's a vagina. Okay, but the actual sex is the baby boy only. Okay, now there is a gonads, this is the testicles. There is actually, remember, right, in the complete androgen syndrome, there is a no axillary hair and a pubic hair. Okay, now, and there is what associated with the nothing here. Remember, for the Mullerian agencies, the actual character is the female only. There is a gonads of ovaries, axillary hairs are present here. Okay, associated with the renal and the skeletal vertebral defects, and the deafness may be present. Okay, remember how this is how you have to remember. Next one are types of joints. You have to remember this one. I think everyone knows about this one. Saddle joint between the what? Thumb. Okay, na. So guys, remember here. Um, remember here carpal to thumb here. See, guys, now you have to remember about this some important types of joints here. First one is the ball and socket joints. Okay, ball and socket joints are examples. We can see here, we are having the shoulder joint. I think everyone know about the shoulder, hip, but most of them don't know about these two also. Because see here, guys, this is the calco-navicular joints. See, guys, here talus, calcaneum, and the navicular in the toe joint, guys. Okay, now heel joint here. Next one is this is the incudostapedial joint. Incudostapedial joint. So this it is between the incus and the steps. So it is the between the incus and the step. It is the ball and socket joints. Remember, from the malleus and the incus, malleus and incus. It is the saddle joint. But incus and step, it is the ball and socket. This is what you have to remember. I'll also remember here, but we have in the cartilage joint two types, primary and the secondary. Primary also called as synchondrosis. Synchondrosis is the temporary joint. Later it will becomes to permanent. Okay, na? This is the secondary is the permanent joint. This is the all the examples of the midline joint. Examples what are pubic symphysis, mandibular, diphisternal, intervertebral. These are all in the midline. Remember here that this is the joint between what? This is the joint between what, amma? This is joint between the what, epiphysis and diaphysis. You know, guys, here it always it is temporary joint only. Later it will become to what, amma? What? Become to permanent. Okay. Example: epiphysis, diaphysis, and all costochondrial joints. Remember this. Next one, syndesmosis. Okay, syndesmosis. Examples are midline, radius, and ulnar bone, inferior tibiofibular joint here. Remember here. This is the example of what, amma? This is example of the syndesmosis, radius and ulnar. So midline of the radius and ulnar. Remember the atlas and axis here. Between atlas and axis, it is the pivot joint. Atlas and occipital bone is the ellipsoid joint. Okay. That's it about the types of joints. Remember here, which is the arches here, from the first arch, second arch, fourth arch, and the sixth arch. There is no fifth arch here. Okay, now there is no fifth arch here. From first arch, there is this is the what I must say, malleus, incus, mandible. Second arch is the S for second, S for second. Okay, now this is the steps. Fourth arch, left arch of aorta. From sixth arch, there is a left ductus arteriosus. How they are going to give in the exam? They are going to give the They're going to give the image of the heart, and they're going to mark at the bottom at the left at the ductus arteriosus, at the left ductus arteriosus, and they are going to tell that from which arch it is going to arise. You have to know about the location also. It means they're asking about the sixth arch. Okay. Next one, see here, from the pouches, guys, from the first pouch, second pouch, third and fourth pouch, guys, what is going to form here? Middle ear cavity, auditory tube, inner layer of the tympanic membrane. From second, right, palatine and tonsils. The third pouch, you have to remember this one. Remember here, from the third pouch, there is a inferior parathyroid gland. From the fourth pouch, it is the superior. Okay, inferior in three. Okay, four superior parathyroid gland. Okay. Remember, guys, here these are the borders. Here remember this is the L1, L2 from C here. These are the abdominal plane lines, planes here. You have to remember this is the it is the automa. This one is the transpyloric. This is the transpyloric plane arises from lower border of the L1, lower border of the L1. Next one is the subcostal plane right here, subcostal plane. Okay, from the upper border of the L3. You know, there is a what here. Next one is the transtubercular. This is the transtubercular plane here is the upper border of the what? Border of vertebra L5. Okay. This is the most expected questions. Please remember this one. And these are the these are the abdominal planes you have to remember. Okay. This one here is the voice of America. This is VOA. First one is the what, amma? First one is this one. Vena-cava opening. O for what, amma? O for esophageal opening. A for aortic opening. This is the TC 10. So 8 plus 2, how much? 10 plus 2, 12. Is the 8, 10, 12. 8, 10, 12. 8, 10, 12. Okay. This is the and remember here it is the 8, 10, 12. Okay, now from the vena cava opening we are having the bottom here. It is the inferior vena cava. Okay, and the right phrenic canal. The right phrenic nerve. From the esophageal opening, guys, this is the it will open at the T10. It will be the esophagus, vagus trunk, and there's a left gastric artery. What am I? Left gastric artery. Left gastric artery. From the aortic opening at the T12, aorta, thoracic duct, and the azygous vein. The aortic and the azygous vein. Okay, remember. Sometimes they are going to give the question and they are going to mark this area and they are going to ask you what passes through it. So you have to remember it is the aortic opening T12 at the T12 level aorta, thoracic duct, azygous vein. Okay. I told about this one Hazelbert triangle, guys. Hazelbert triangle. If it was passes through the Hazelbert triangle, it is the direct hernia. Okay. If it's okay, yeah, you have to remember the borders. Remember the borders of the Hazelbert triangle. Just by heart this. Next the femoral triangle here. Remember the anterior is the inguinal ligament, medial lacunus, medial lacunar, lateral aral femoral, posterior P for what a pectinus major. Remember this one. I think everyone knows about the calot triangle here. Calot triangle is for the superior, middle, and inferior. This is the calot triangle. Wait. These are the construction, guys. These are the constructions. So, for example, there is one another question is asked in the July Fmge examination of 24 here. So, for example, they told that this is the 23 centimeter. Okay, where is the construction? It is at the arch of aorta. There is 28 centimeter. Where the construction at the left principal junction. So, this is the question. This question is asked in the July exam. Okay. So, for example, and also they give you there is a construction at 15 centimeter where it is the para esophageal junction. Remember about the you remember about that important amino acid how they're going to ask you, test you, see the tryptophan. From the tryptophan, we are going to get the what? Niacin, melatonin. Okay, niacin and what? Niacin and serotonin and melatonin. Okay, see tryptophan. Fan means what? They're going to see fan sleeping. This is the melatonin. Melatonin, serotonin, and niacin. Histidine, histamine. Histidine, histamine. Glycine, it helps in the synthesis of heme synthesis. Next is arginine, we get arginine, nitric acid, arginine, nitric oxide, urea, creatinine, glutamate, GABA, glutathione. See how you have to remember. Just remember this. I think you guys know about this one, about the amino acid, which is the acidic, which is the basics. Acidic, basics are hydroxyl group, sulfur containing basics, aromatic. Essential amino acids are remember this mnemonic. Semi-essential, simplest is the glycine. 21st is the cellular system. Code for UGA. Remember, guys, this one the electron transport complex inhibitors. For the complex 1, 2, 3, 4, 5, 6, 7, 4, 4, 5. What is going to inhibit? Okay, this is the complex one. Remember that it is the phenobarbital ONE1 here, ONE1 here. So it is the watermark complex 1. Okay, so we have measured the complex 4 is the cyanide poisoning, cyanide, carbon monoxide, and the sulfur here. Remember these two. Remember, guys, this. And also, if you remember, these are the uncouplers here, 2,4 DMP, and this is the aspirin here. It acts the uncouplers, and the physiological uncouplers, they are watermark brown fat. See for thermogenesis, example, which one? Thyroxine. Not thyroxine. This is, you have to remember about the electron transport complex inhibitors. Remember here the tyrosine 1 and 2. See tyrosine 1, it is called as the hepatorenal. It is called as the hepatorenal. Bola hepatorenal tyrosine. Tyrosis. Hello? Hmm. कब है? कब है? So tyrosinemia type 1 is called as the hepatorenal tyrosine or tyrosinosis. Remember here, see here. Just remember the enzyme. See, tyrosinemia. It is the fumarate acetoacetate. See, fumarate. F for what? F for first. F means first here. That's why it is the tyrosinemia. It is the type 1 is the first. It is the fumarate. F means first. It is the fumarate acetoacetate. Remember here, remember here, tyrosinemia type 2. Type 2 means what is also called as oculocutaneous. See, guys, the oculo means eye, cutaneous means skin. It means it is having the two types. Okay, oculo means what, Amma? Oculo means two eyes. How many eyes there are? There are two eyes. That is the type 2. It differentiate what, Amma? TTT. This is TT. There is two T. Tyrosine transfer. Tyrosine and transaminase. We are two T's. That's why the tyrosine type 2. Okay. Just remember this. Remember these enzymes. Next, guys, we are having the familial dyslipidemias, and this is the non-familiar. Okay, na? This is the non-familiar. This is the familiar. Okay, na? This is the non-familiar. This is the familiar. Just you have to remember about this. The first two one. Okay, this is the hyperchylomicronemia, hypercholesterolemia, and this is just remember the pathogenesis, known pathogenesis and the clinical features. This is what you have to just by heart this. Okay, by heart these two. This is the non-familiar. Okay, non-familiar. This is the familiar one. Please by heart this one. Next one, this one the disaccharide lactulose form. See the lactulose rasi here, lactulose. How you are going to remember this one? See lactulose here, to see, like to lose. See, like to lose means see. Oh my goodness, I lose my GF. Oh my goodness, I lose my GF. See, GF means what? Galactose plus fructose. Galactose plus fructose. See, how you are going to see GF means if the glucose or galactose, it is a galactose. How is the lac? Here lac. That is the galactose plus fructose. From this glucose gas, we'll see the G L G. It's the LG. Glucose plus lactose. Glucose plus here. Next one is the glucose plus fructose. It is the sucrose. Yes, my GF. Next maltose is glucose plus glucose. Remember from this one, from all these, from the glycogen storage diseases. Yeah, yeah. So the glycogen storage diseases here. So guys, from among these all these diseases, guys, the most important one is the most important one is the what? This is the Gaucher disease. See, out of all lysosomal disorders, the most important one is the most common is the what is the Gaucher disease. That's why you are going to study the Gaucher disease briefly here. See, it is the most common lysosomal storage disorder. It is the autosomal recessive. Chromosome is the one here, and it what the enzyme deficiency is the beta glucocerebridase. Okay, na? Chief complaint is the watermark. There is a pancytopenia, bleeding manifestation, pseudo, CRS, and there is a bone pain here. In the X-ray, we'll see the femur. As the femur, will see the Elmer flax deformity. See, guys, just remember this is the watermark. Crumpled paper. This is the crumpled paper appearance here. This is also called as the Gaucher cells. This is how the baby is going to present. So, guys, next we are going to talk about glycogen storage diseases, guys. You need to remember here we are having the total 7 types here. Remember, this is the guys. One thing to remember here, all which one involves the which are going to involve the liver. The type 1, 3, 4, 6. 1, 3, 4, 6. Okay. 1, 3, 4, 6. See, 1, 3, 4, 6. 1, 3, 4, 6. 1, 3, 4, 6 are liver. 1, 3, 4, 6 going to involve the liver, and the remaining are going to involve the what? Liver and the muscle here. That's how they're going to ask the question here. For this one, there is a this one. Fasting hypoglycemia, hepatomegaly will be the manifestation. Remember here, how to remember is there is a see versatile player Corey Anderson made history today. See, like sometimes they are not going to give the disease name directly, but unless they are going to give the type 1, type 2, 3, 3. So, for example, they are going to ask the question as the what is the enzyme deficiency in the type 3. Okay, type 3 means what is the Corey's disease. It is a deep branching. That's how you are going to ask. But most of the times they're going to ask the type 1. V versatile player. Versatile V. What is the one drug? Most common one we have been studying in children's. Enzyme deficiency is the glucose 6 phosphatase. Liver. See, there is going to be what? There is going to be severe fasting hypoglycemia. Fasting hypoglycemia, and the baby is like a what? Doll, moon or doll like faces. There is a moon or doll like faces here. Okay, na? Moon or doll like faces here, and there is a lactic acidosis from the womb garba. Next one is the Pom's disease. Pom's disease is the skeleton and the cardiac muscle here. Skeleton and the cardiac muscle involvement here. Remember the all that first of all, the guys, the enzyme deficiency is important. Okay, now remember one thing here, see here, this is the remember, see A B means Anderson disease, B means branching. A B A B A B C D C D ra C D means what is debranching enzyme in a Cori disease. Okay, now see here A B Anderson disease branching, B A B C D Cori disease and the debranching enzyme. Remember, they were going to ask you that this is the exercise. This is the exercise induced muscle cramps in patient. For example, one gym guy got the muscle cramps and something. They will give the history like that one. That is the myocardial disease. Enzyme is the muscle glycogen phosphorylase. That's how you have to remember. At least remember this. Okay. Next one is the lysosomal storage disorders here. I all told about the Gaucher disease. Next one is this is the takes disease. This takes side disease. This is the takes tax disease. Is the hex hex hex. So amylase A. So this is the Tay sax. Tay sax means hexose amylase enzyme deficiency here. Okay, now Fabry disease. Fabry disease. Here the enzyme is the what? Alpha galactosidase. Alpha galactosidase. Just remember this guy. Just remember the Niemann-Pick disease. There is the what? Sphingomyelin. Sphingomyelin. Okay, na? Just remember this. Okay. So let's just try to study the findings. But most of the times they are going to ask about the only the enzyme deficiency only. Just you have to remember this one. But most commonly they are going to ask is the Gaucher disease. Okay, or else you can just read the deficiency enzyme. Next one is this is a mucopolysaccharide disorder. We are having the Hurler syndrome and the Hunter syndrome. Hunter syndrome. Hurler syndrome, Hurler syndrome, see here, and the Hunter. See the Hunter, we are going to have they are going to hunt. Hunter, that is a what? Enzyme deficiency is the iodinate, iodinate sulfate. Okay, iodinate to sulfate. Here in the hurler, this is a C. Hurlers, there is a hurler. This is going to be I. This is the iduronate. Alpha 1 iduronate. Huntera iduronate 2 sulfate. These are the see here this how they are going to ask this. First of all, they are going to ask the enzyme. Okay, enzyme. Next, there is a see Hunter syndrome. There is a mild hurler symptom plus aggressive behavior. There is a there is no corneal clouding. Sierra for the hunter, they need to have the good vision. That's why there is a no clouding. It's the hunter. There is a corneal clouding. Okay. Also remember here, hunter can see. Okay, I told about it. There is hyperlipidemia signs here. Xanthomas, tendinous xanthoma, and corneal arcus. Xanthoma ra, here remember here is the plaques or nodules composed of lipid-laden histiocytes in skin, especially in the eyes. It's called the xanthosoma. Xanthosoma. They're just going to give these images. They're going to give these images ra, and you have to identify this is the xanthoma. This is the tendinous xanthoma. Deposition of here, lipid here in the tendon. This is the corneal arcus. This is the lipid deposition in the cornea. I'm done already with this slide. Already I teach in this one in the genetics topics. Okay, this is from the ENT. See here, this is the audiograms here. This is the audiogram here. This is the main. This is the what? This is the manius disease. Because see here, it's always the this is the rising. This is the rising audiogram. See here, men will always rise. Men will always rise. See, it is the always here. It is rising here. This is the press by consider press by QCC. Okay, this is seen in the aged in the old man. That's why old man's always fall down, always fall down. Okay, that's why it is the sloping diagram. Okay, now this is the this is what this is the Hertz. Now this is the Hertz notch at the 2000. Notch at the 2000. It is the seen in the case of the otosclerosis. Is the otosclerosis. Okay, now just remember that otosclerosis is a 2K notch. And there is a noise induced. There is a noise induced hearing loss. The noise induced hearing loss as the notch at the where? Notch at the 4000. Notch at the 4000 here. This is how they are going to ask in the questions. This one, guys, this is the a pregnant female with conductive hearing loss. Examination shows the below image diagnosis is. This is the Swatch sign of Flamingo Swatch sign here. Okay, flamingo. The means what am I? Flamingo is like a bird. It's the pink in color. This is the pink in color here. So, guys, remember that here. If they are going to, if they are going to ask, they are going to mention there is a pregnant, there is a young, young pregnant female with the conductive hearing loss. With the conductive hearing loss, they remember the diagnosis must be it is the otosclerosis because the pregnancy is the main trigger. Okay, na? Most common in the young female pregnancy aggravate. Most common site is the fistula antifenestrum. What is the site is the fistula antifenestrum. Patient hear better in noise area. It is called as the see here. Patient will hear better in noisy area. It is called as the paracusis willis. Okay, there is a Schwarz sign seen in the early stage, but later it is changed to flamingo pink appearance. Okay, na? Next one is the stepidotomy, and there is a sodium fluoride given in the early stage. Okay, sodium fluoride given early stage. Sorry for the disturbance, guys. Next one is the glomus jugalera. Next is the glomus jugale. I think everyone knows there is a rising sun sign. There is a pulsatile tinnitus, bleeding ear mass, and there is a brown sign. Okay, now there is a on CT scan. You will see the on the CT scan you will see the Phelps sign. Phelps sign. Okay, now just remember that this is the glomus jugale. Okay, glomus jugale. This is the rising sun sign. If you see this sign in the question is the rising sun sign is the glomus jugale. Glomus jugale and the pulsating tinnitus is the glomus jugale. Next one is the acoustic neuroma. I think everyone knows one is the also called as vestibular neuroma. The tumor of eighth cranial nerve, most commonly as the cerebellopontine tumor. It is associated with the neurofibromata. What neurofibromatous to there is you'll see the rollover phenomenon. You see the rollover phenomenon there. The sign called Heisenberg sign. Investment choice is the MRI with the gadolinium. MRI with the gadolinium. You can also see that there is a ice cream. There is a ice cream. Okay, na? Remember, there is ice cream appearance. Okay, ice cream pattern appearance. And also there is a Anthony 1 and B factor. Okay, on the hand histopathology, this is the acoustic neuroma. They are all the guys. They are all the golden points only. Okay. Next one, the tumors of the bone. This is appears to be what amma? This is the subobal. Subobal appearance seen in the Janssen tumor, also called the osteoclastoma. This is the epiphyte amma. This is the exostosis amma. There is a cartilage cap here. There is a bony outgrowth. This is the exostosis. It is the called as osteochondroma. This is seems like what am I? It seems like this is the onion pin. This is the onion skin. You know, onion skin appearance seen in the having sarcoma. This is the most radiosensitive. This is the what am I? Needles type here. So this is the needles type here. Needles. They will in the history they will mention that there is a history of night bone pain. Night night bone pain. Night bone pain is the osteoid. Next one is this is the essentially what sunburst appearance. This is sunburst appearance. So in the case of the osteo sarcoma. Okay. Next one, we are having some triads here. Some triads here. This is Samtus triad, Samster triad, asthma, aspirin sensitivity, ethmoid polyp, Young's triad. Here recurrent sinusitis, agiospermia, bronchiectasis, and arsal polyp. This is the question that they asked in the one of the exam. The carcinomas triad, sinusitis, situs inversion water. The heart will be present in the right side. There is a bronchiectasis here. We also have the pulmonary syndrome. This is a dysphagia, anemia, and the esophageal valves. Yeah. This is the question they asked in the exam. From here, this is the what? This is the fossa of a Rosenmuller. This is the fossa of a, this is the uh esophageal. This is the I will tell you. So guys, this one is the ET tube. Okay, so okay. Okay, this is the ET tube here. But here, guys, this one, remember this one. This one is the fossa of Rosal. This is the fossa of Rosal Munnar. Okay, now. So, fossa of Rosal Muller here, the most common site for the what for the nasopharyngeal carcinoma. For the nasopharyngeal carcinoma. Okay. Oh, okay, now here. They're just going to mark in the exam as mark as so from this one what is the going to the what is the what tumor is going to arise. It is the nasopharyngeal carcinoma. It's more common in China. I think everyone knows about the China. It is the history of EBV virus. Okay, and this one is the ED2B. Okay, so it's done. I will continue this tomorrow. Okay, thank you very much, guys.